In this video, we present to you the ocular motility test. Did you know that our eyes has 6 extraocular muscles? These are the superior rectus, inferior rectus, lateral rectus, medial rectus, superior oblique, and inferior oblique, which when functioning properly, it allows our eyes to move in a wide range of gaze. The test that assesses the movements of these extraocular muscles and the alignment of eyes is what we call the ocular motility test, specifically the Broad-Edge test. The purpose of the test is that it checks and evaluates our 6 extraocular muscles through directing our eyes to the 9 cardinal points. It simply means that it can determine how well your eyes can follow a moving objects. These are the advantages of the ocular motility test. First, it is the simplest method of evaluating a deviation in the 9 diagnostic positions of gaze. Second, it is relatively quick and easy to perform and requires no extra equipment. Lastly, it is used as a screening technique in the assessment of versions. Its only disadvantage is that it requires practice in terms of both dexterity and interpretation of the results. This test involves observing the patient's eyes as they move to follow a pen light or non-luminous target in an H pattern. Ocular motility should always be tested, especially when patients complain of double vision or when a patient is suspected of having neurologic disease. The procedure. Keep the room lights on and illuminate the eyes without shadows and explain the test to the patient. Ask the patient to remove any spectacles. Then sit directly in front of the patient so that both eyes can be viewed simultaneously. Instruct the patient. Patient, please watch my light and follow it with your eyes. Keep your head still. Tell me if the light appears doubled or blurred, or if your eyes feel uncomfortable at any time. Then shine the pen light towards the patient from approximately 40 centimeters. Move the pen light into the 9 diagnostic positions of gaze by moving the target in a broad H formation. During down gaze, you may need to hold up the patient's eyelids to gain a useful view. You may also need to transfer the target or the pen light from your left to your right hand when switching between the patient's right and visual fields. Carefully look for any misalignment of the eyes in all positions of gaze and also determine whether the movement of the eyes are smooth and accurate. Note and record the position of the eyes when any of the following occur. First, if the patient reports any diplopia or discomfort. B. Any underaction or overaction in one eye. C. Jerky or inaccurate pursuit eye movements. This is the clip on how it is performed. Recording and interpretation. Where the ocular movements appear full and no diplopia is reported in any position, a normal result has been obtained. This is usually recorded using the acronym SAFE or FESA. This indicates that the ocular motility movements were S for smooth, A for accurate, F for full, and E for extensive. For a patient with strabismus, normal motility can be recorded as no incompetency detected. In cases where you detect incompetency or diplopia is reported by the patient, record an H pattern to clearly indicate where diplopia was experienced or incompetency noticed.
Also, record any apparent underactions or overactions, clearly stating which eye and in which gaze direction this was observed. Intermittencies are recorded using a 9-point scale. Underactions are recorded as negative numbers on a scale from -1 to -4, where -4 represents the greatest underaction. Similarly, overactions are recorded using positive numbers on a scale from +1 to +4, where +4 represents the greatest overaction. Normal and other abnormal findings. So this is for the normal findings wherein the patient's ocular movements appear smooth, accurate, full, and extensive. And I'll be showing the different examples of an abnormal findings. And these are the exotropia, when there is a deviation on upward gaze, and left fore nerve palsy. And now, let's proceed to the other tests for ocular motility.
And now, let's proceed to the pursuit test. So what is the pursuit test? So the pursuit test is a test of a central vestibular system assessing the patient's ability to accurately track a visual target in a smooth, controlled manner. So this test involves observing the movement of a patient's eyes as they follow a moving target and determining their smoothness and accuracy. For the importance of this test, pursuit test is one of the ocular motility tests. It is important because it determines whether there is a central pathology that is precluding accurate tracking of moving target by the eyes. And now, let's move to the advantages of the pursuit test. So first, it is simple and repeatable assessment of pursuit eye movements can be made by a direct observation of the patient's eyes as they follow a moving target. And second, as the test is performed during the motility and broad age testing for incompetency, the pursuit reflexes can be assessed at the same time. Alternatively, pursuit eye movement can be assessed separately. For the disadvantage of this test is the information obtained is qualitative rather than quantitative. For this reason, the same test result may be interpreted in different ways by different practitioners. For the equipments, the examiner should use the fixation target, and for the specific patient, kids and adults are allowed to this test as long as they can follow and understand the instruction of the examiner. So for the procedure of a pursuit test the procedure is the same as the motility testing. You should look for a jerky pursuit movement, fixation, losses, or movement that are not the same speed as the movement of the target. And the assessment can be repeated monocularly and binocularly during induction testing if binocular problems are seen. First thing to do is have the patient sit facing you. Second is hold a fixation target with the colored tip pointed towards the patient. Third, move the fixation target in a horizontal line at eye level at a constant speed and have a patient track with just their eye. And fourth, repeat 5 to 6 times in the horizontal direction and then test in the vertical direction. Fifth is look for any non-smooth or jerking motion. Next is the recordings. So if it is normal pursuit eye movement or scene, you should record smooth and accurate pursuit or similar. And if it is abnormal, you should record the type of the abnormality and indicate if one eye is more at fault than the other. Next is the interpretation of the pursuit test. So first, the pursuit eye movement should be smooth, conjugate, and accurate with minimal losses of fixation. Second is the abnormal pursuit eye movement should indicate ocular motor nerve paralysis, cerebellar disease or Parkinson's disease, or they may be due to a systematic medication, particularly antidepressant. So for the normal smooth pursuit result, a patient with the ability to perform smooth pursuit tracking normally will produce a response in which the stimulus target and the eye tracing are almost identical. So as you see in the picture, the stimulus is the yellow target line, and the right and the left eyes are in the red and blue tracing. The responses of each cycle of the pursuit are represented on the graph by red dots for the right eye and the blue dots for the left eye. Responses that are within threshold limits will fall in the white region, and responses outside the threshold limits will fall in a gray shaded region. So next is the abnormal smooth pursuit result. So it is important to know that the smooth pursuit test is the most sensitive of the ocular tests to age effect. Those older patients are more likely to produce errors during the performance of the test. So unlike saccades, where the movement of the eye is something that is unconsciously done many times throughout the day, the smooth pursuit test is something that may need to be taught to the patients. So it is necessary to perform 2 or 3 trials of the test to look for the patient's best performance. Unlike the patient perform the task accurately on the first trial. It is possible that the patient can accurately track the target in one direction but not in the other direction. So in most cases, the abnormality will present itself toward the side that has the lesion.
And now let's proceed to the saccades test.
What is the saccades test? Saccades test is one of the types of eye movement test. Saccades refer to fast conjugate eye movements that shift the eyes from one target to another, bringing an object of interest into focus on the fovea where the visual acuity is the highest. How important are these tests? Saccade test is one of the ocular motility tests. These tests are important for detecting concomitant deviations. To gain maximum information from this test, a thorough knowledge of the anatomy and physiology of the extraocular muscles is essential. The advantages. First, a simple assessment of saccadic eye movements can be made by direct observation of the patient's eyes as they switch fixation from one target to another. Second, no additional equipment is required. Third, this test is very simple, quick, and reasonably reliable. The disadvantages. First, if any abnormal pattern of saccadic eye movements does exist, it is likely to become apparent during other binocular vision testing. Second, the information obtained is qualitative rather than quantitative. For this reason, the same test result may be interpreted in different ways by different practitioners. The procedures in performing the saccadic test. First, sit the patient comfortably with their head erect and eyes in slightly downward gaze. Make sure that the patient is wearing their near correction. Then sit directly in front of the patient so that both eyes can be viewed simultaneously. Second, keep the room lights on. Position additional lighting to illuminate the patient's eyes or the target, whichever is necessary without the shadows. Third, explain the measurement to the patient. This test determines how well your eyes move to change their viewing position. Fourth, hold your right and left index fingers pointing upwards approximately 30 to 40 degrees either side of the patient's midline and at a distance of 40 to 50 centimeters from a point midway between the eyes. Fifth, instruct the patient, please look at the right target stick, now at the other target, and now the right target again. Repeat this test for about 5 cycles. The equipment needed for this test is only fixation target, the recording. If normal saccadic eye movements are seen, record saccads as 4 positive or 3 positive, which stands for smooth and accurate saccads. If saccadic eye movements are abnormal, which is 2 positive or 1 positive, record the type of abnormality and indicate whether one eye is more at fault than the other. The grade saccadic movements into 4 categories. 4 positive stands for smooth and accurate, 3 positive for slight undershoot, 2 positive for gross undershooting or any overshooting or slight increased latency, 1 positive for inability to do the task or greatly increased latency. The assessment should be repeated monocularly or if binocular problems are present or if the test result is 2 positive or 1 positive. For normal saccad test results, a patient with the ability to perform a saccad test normally will produce a tracing in which the stimulus target and the eye tracings are almost identical. As you can see in the chart, the stimulus is represented by the yellow target line and the right and left eyes are represented by the red and blue tracings. The responses for each saccad are represented on the accuracy, velocity, and latency graphs by red dots for the right eye and blue dots for the left eye. Responses that are within threshold limits are in the white region and the responses outside of threshold limits are in the gray shaded region. For abnormal saccad test results, you should take 3 parameters into consideration for the analysis of the saccad test. As you can see in the chart, first, latency, how long it takes the patient's eyes to find the target. Second, accuracy, whether the patient can move his or her eyes to the target without overshooting or undershooting the target, which is also referred as precision. Third, velocity, how fast the eye moves from point to point. Saccad testing is an ocular test used to determine whether there is central pathology that is precluding accurate fixation of the eyes onto moving targets. Each of the saccadic subtests can give anatomy-specific information about the patient's central vestibular system.
And that would be all for ocular motility test. Thanks for watching!